From avian flu outbreaks to the spread of Marburg virus, new pandemic threats are emerging faster than ever. These aren't just distant possibilities. They're real risks we need to understand today. In this video, we'll break down what's happening, why it matters, and what we can expect moving forward. Stay with us as we explore the current landscape of pandemic threats that could change everything. Welcome to Prepper's Paradigm, your go-to source for practical and insightful prepping content. Today, we're diving into current events to discuss some of the most pressing pandemic threats on the horizon. We'll look at outbreaks and rising concerns surrounding viruses like avian flu, Mpox, Marburg, and other potential health crises making headlines. Our goal is to inform you of what's out there, how these threats are evolving, and why it's important to stay aware. Before we move forward, I want to remind you that I use a computer-generated voice in these videos due to an injury that affects my speech. This ensures I can continue to provide you with high-quality information that's easy to follow. In this video, we'll outline the latest updates on these viral threats, discuss the global response, and touch on how understanding these developments can help you prepare more effectively. Let's explore what these potential pandemics mean for all of us. To start, let's take a look at some of the most notable pandemic threats currently making waves. First up, avian flu, specifically the H5N1 strain, has been causing concern in recent months. While avian influenza primarily affects bird populations, instances of transmission to humans have been reported. These cases are rare, but have a high mortality rate, making close monitoring essential. Health experts worry about mutations that could make the virus more easily transmissible among humans, which could trigger a significant public health crisis. Next, Mpox, formerly known as monkeypox, has continued to spread in various regions despite past containment efforts. While its transmission is lower than that of more familiar viruses like COVID-19, it poses a risk due to its severe symptoms and potential long-term impacts. Recent outbreaks have been reported in both established and new regions, signaling the need for ongoing vigilance. Then there's the Marburg virus, an illness similar to Ebola, known for its high fatality rate and severe hemorrhagic symptoms. This virus has recently seen outbreaks in parts of Africa, causing alarm due to its rapid spread within communities and healthcare settings. While not currently at pandemic levels, Marburg virus represents a serious concern should containment efforts fail and international spread occur. Finally, we have the overarching concern of antibiotic-resistant pathogens. While not a pandemic virus per se, the rise of drug-resistant bacteria is an escalating global health issue. The reduced effectiveness of common antibiotics could compound the impacts of future pandemics, making treatment significantly more difficult. These emerging threats illustrate that the risk landscape is ever-changing and requires awareness and preparation. Now, let's examine how global and national responses are shaping up to address these emerging threats. Understanding the measures being taken by governments and health organizations can provide valuable context and inform individual preparedness. Globally, the World Health Organization has been closely monitoring the situation. For avian flu, ongoing surveillance efforts have been ramped up to detect human cases early and prevent potential outbreaks. In regions where the virus has affected poultry, governments have implemented culling measures and stricter biosecurity protocols to curb the spread. However, experts have raised concerns over gaps in international coordination that could hinder a swift response if the virus adapts to human transmission. For Mpox, response strategies have shifted since its initial outbreak. Public health campaigns have been implemented in high-risk areas, focusing on vaccination drives and educational outreach. These measures have helped slow the spread, but isolated cases continue to emerge, emphasizing the need for continued vigilance and resource allocation. Marburg virus poses unique challenges due to its high fatality rate and rapid transmission in certain conditions. Countries affected by recent outbreaks, primarily in Africa, have worked with international health organizations to deploy rapid response teams and contain the spread. Isolation protocols, contact tracing, and experimental treatments are being used to manage cases, but the limited availability of vaccines and treatment options poses a significant barrier. At the national level in the U.S., public health agencies like the CDC are enhancing their preparedness plans. Lessons learned from COVID-19 have influenced current strategies, focusing on rapid response and the stockpiling of medical supplies. However, There remain questions about whether current preparedness is sufficient to handle simultaneous or cascading crises. It's clear that while efforts are underway to mitigate these pandemic threats, gaps remain. These responses, though varied and evolving, provide a framework for individual preparation and highlight the importance of staying informed. Recent updates on the Marburg virus outbreak indicate that the situation remains primarily contained within Rwanda, which has been experiencing its first ever outbreak. As of late October 2024, the country has reported 64 confirmed cases, with 15 resulting in fatalities. Most of these cases are centered in Kigali, the capital city, signaling significant pressure on local healthcare systems. The Rwandan government, alongside international organizations like the World Health Organization, has been active in deploying containment measures, including isolation protocols and contact tracing. While there have been isolated cases linked to travel from Rwanda, including one in Germany and another monitored in Belgium, further spread has not been reported. The response in these countries involves swift isolation and monitoring of potential contacts, which underscores the importance of rapid action when dealing with viruses of this nature. These developments highlight the need for robust global surveillance and cross-border collaboration to prevent further outbreaks. The CDC has stated that no Marburg cases have been reported in the United States. However, this serves as a reminder of how interconnected our world is. The movement of people and goods means that any outbreak, no matter how localized, could have far-reaching effects if left unchecked. This is why it's critical to stay informed about potential threats, even those that may seem distant at first glance. With global monitoring continuing and health authorities on high alert, the focus remains on containing the virus and preventing it from becoming a widespread international threat. Understanding the current situation is one thing, but knowing what it means for individuals is equally important. While the Marburg outbreak in Rwanda has not yet expanded into a global crisis, it serves as a stark reminder of how quickly situations can escalate. For those of us keeping an eye on potential pandemic threats, staying informed and prepared is key. First, keeping up with credible sources such as WHO and the CDC is essential. These organizations provide real-time updates and guidance, which can help you understand if and when a localized outbreak might pose a wider threat. Monitoring news about cases linked to international travel is also valuable, as it can signal early signs of a virus crossing borders. Second, while the immediate risk outside of Rwanda remains low, having a basic level of preparedness ensures you aren't caught off guard if circumstances change. This could include ensuring you have a well-stocked medical kit that includes items specifically useful for viral outbreaks, like gloves, masks, and disinfectants. It's also wise to have a plan for limiting exposure, such as having essential supplies to reduce trips to public spaces during an outbreak. Finally, remember that being proactive doesn't mean panic, it means preparation. The presence of Marburg cases in Europe, though limited and contained, shows how interconnected our health security is. A vigilant but calm approach, combined with awareness of global health developments, can position you to act quickly if the situation changes. As we've explored, the current landscape of pandemic threats can develop quickly. For example, recent significant developments include the outbreak of the Marburg virus in Rwanda and isolated cases linked to travel in Germany and Belgium. This adds to existing concerns over other emerging health risks, including avian flu and Mpox. While these viruses may not yet pose a widespread threat outside their current regions, they highlight how interconnected and vulnerable our global health system can be. Staying informed is key as the situation can change rapidly. Monitoring updates from trusted networks helps provide the latest, verified information. While international and national health responses work to contain these threats, awareness remains one of the most powerful tools we have. Thank you for joining us in exploring the current pandemic threats we face in 2024. Follow Prepper's Paradigm for more news, updates, and insights into staying prepared for whatever the future holds. If you found this video helpful, don't forget to like, share, and subscribe for more content. Stay informed, stay aware, and stay ready.